This medication, Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam, is used to treat certain bacterial infections. It contains two medications, sulbactam and durlobactam. Sulbactam is an antibiotic that stops the growth of bacteria, while durlobactam is an enzyme inhibitor that helps sulbactam work better. It is important to note that this product only treats bacterial infections and will not work for viral infections, such as the common cold or flu. It is crucial to use antibiotics only when needed, as using them unnecessarily can cause them to not work for future infections. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. If you're prescribed Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam, it will be given to you by injection into a vein, usually every 6 hours. The injection will be done slowly over 3 hours. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. If you're using this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. It's important to check the product for any particles or discoloration before using it. If you see either of these, do not use the liquid. Also, be sure to learn how to store and discard the medical supplies safely. For the best results, use this antibiotic at the same times every day. This will help you remember to take it consistently. It's important to continue using this medication until the full prescribed amount is finished, even if your symptoms seem to improve before that. Stopping the medication too early may cause the infection to come back. If your condition lasts or gets worse, be sure to talk to your doctor about it. If you experience diarrhea that lasts or worsens, notify your doctor or pharmacist right away. This medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of side effects. Most people taking this medication do not experience serious side effects. However, it's important to tell your doctor immediately if you experience muscle cramps, irregular/fast heartbeat, signs of anemia, such as unusual tiredness, pale skin, rapid breathing, or signs of liver disease, such as nausea/vomiting, loss of appetite, yellowing eyes/skin, dark urine. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, contact your doctor right away. Do not use anti-diarrhea or opioid products if you have these symptoms, as they may make them worse. Xacduro may sometimes cause oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Remember to call your doctor for medical advice about side effects. Before starting Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam, make sure to inform your doctor or pharmacist if you have any allergies to sulbactam, durlobactam, penicillins, cephalosporins, or other beta-lactam antibiotics, or other beta-lactamase inhibitors. Also, let them know about any inactive ingredients that may cause allergic reactions. If you have a history of kidney disease, it's important to discuss this with your doctor or pharmacist before using this medication. Additionally, be aware that durlobactam/sulbactam may affect the effectiveness of live bacterial vaccines, so inform your healthcare professional if you are undergoing any immunizations or vaccinations. Before undergoing surgery, make sure to disclose all the medications and products you are using to your doctor or dentist, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam should only be used if clearly needed. It's crucial to have a discussion with your doctor about the potential risks and benefits. Lastly, if you are breastfeeding, consult with your doctor before using this medication, as sulbactam passes into breast milk and it is unknown if durlobactam does as well. When taking Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to communicate with your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. This will help them to identify any potential interactions and make sure that Xacduro is safe for you to use. It's important not to start, stop, or change the dosage of any medicines without the approval of your doctor. If someone has taken too much Xacduro, they may experience serious symptoms such as passing out or trouble breathing, and should seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures. It is important to seek help right away if you suspect an overdose. This medication should only be used for the condition it was prescribed for. Do not share it with others or use it later for a different infection unless directed by your doctor. Your doctor may also require you to undergo certain medical tests while using this medication, so be sure to keep all scheduled appointments and consult with your doctor for more information. Make sure you take each dose of Xacduro 1 gram, 0.5 by 2, intravenous solution sulbactam as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. It's important not to take a double dose to make up for a missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Make sure to properly dispose of the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.